Welcome to Plastica Review, where we're going to go through the latest papers on minimally invasive procedures and aesthetic medicine for the month of April. Now we begin with a paper by Sebastian Cotofana from West Indies and colleagues, in which they explore the anatomy of the forehead compartments of the face. This anatomic study is performed on 20 cadavers. 10 were employed for dissection and 10 for CT scan. The authors were able to identify 3 superficial compartments, 1 central and 2 lateral, and 3 deep compartments, also 1 central and 2 lateral. They argue that this may be valuable for forehead augmentation with fillers because once the cannula is placed in the deep compartments, the filler may be spread manually with a manipulation afterwards across the depth of the compartment. They also alert of communication of the superficial central compartment with the eyelid. In case filler material is placed at this level, it can go through into the eyelids, posing a danger in this regard. The next paper is from the experimental section of PRS. It's signed by Derek Wan, Michael Longaker, and colleagues from Stanford, California. And it states that purified adipose-derived stromal cells provide superior fat graft retention compared with unenriched stromal vascular fraction. They found out that graft take with stromal vascular fraction alone was around 55% with a 25% standard deviation, while the group in which the fat graft material was enriched with purified stromal cells had a graft take of around 70% with only a 7% standard deviation. Now they argue that cell-assisted lipotransfer with purified adipose-derived stromal cells may not only provide higher retention rates, but also more predictable rates of retention. And going on to ASJ, there's also a very interesting paper on stem cell research signed by Peter Rubin and colleagues from Pittsburgh, in which they find out that adipose stem cell function is maintained with age through a study of cryopreserved fat graft material in the same patient population through an intra-subject study of long-term cryopreserved cells. The study is performed on 3 subjects that had an interval of 7 to 12 years from the first take of their graft material to the second one. And the commentary is performed by Michael Longaker from Stanford, again, one of the world experts on stem cell research and fat grafting science. And he states that, of course, there is a problem with only having 3 patients and from only studying cryopreserved fat. But again, he does emphasize the importance of studies such as these that conclude that the potential of adipose-derived stem cells seem to be maintained with aging. And that's all for the minimally invasive procedures and aesthetic medicine papers of the month of April. I hope to see you all next month on Plastica Review. Thank you very much.